Hey there viewers, in this video, we'll be diving into the world of supplements for constipation relief. We'll explore the evidence behind various supplements, their mechanisms of action, potential side effects, and precautions. By the end of this video, you'll have a comprehensive understanding of how these supplements can help alleviate constipation symptoms and how to incorporate them safely into your routine. So, let's get started. Constipation is a common digestive issue that affects many people worldwide, causing discomfort and impacting overall health and well-being. While lifestyle changes like increasing dietary fiber and fluid intake are often recommended as the first line of treatment, certain supplements may also help alleviate symptoms. Let's start by talking about magnesium supplements. Magnesium is an essential mineral that plays a crucial role in promoting regular bowel movements. Supplements like magnesium citrate, magnesium oxide, and magnesium sulfate have been shown to improve constipation symptoms. They work by drawing water into the intestines, softening the stool, and promoting muscle contractions in the digestive tract. In fact, a high-quality, 28-day randomized, double-blind, placebo-controlled study conducted by Mori and colleagues in 2019 found that taking 1.5 grams of magnesium oxide daily significantly improved stool consistency, quality of life, and transit time compared to a placebo in patients with chronic constipation. The study, published in the Journal of Neurogastroenterology and Motility, also noted that participants reported a higher frequency of spontaneous bowel movements and a reduction in the use of rescue medication. However, it's important to keep in mind that magnesium supplements may cause side effects such as bloating, diarrhea, and abdominal cramping, especially when taken in high doses. If you have kidney disease, it's best to avoid magnesium supplements, as impaired kidney function can lead to a buildup of magnesium in the body, potentially causing toxicity. So, what's the recommended dosage for magnesium supplements? It varies depending on the specific supplement form and individual needs. In the study by Mori and colleagues, participants took 1.5 grams of magnesium oxide daily, which was well tolerated and effective. However, it's crucial to consult with a healthcare professional to determine the appropriate dosage and duration of use based on your unique factors, such as age, health status, and potential interactions with other medications. Pregnant women should exercise caution when considering magnesium supplements for constipation relief, as some forms of magnesium, such as magnesium sulfate, may not be safe during pregnancy. If you're pregnant, it's essential to consult with your healthcare provider before starting any supplement regimen. Now let's move on to probiotic supplements. Probiotics are beneficial bacteria that help maintain a healthy balance of gut microbiota. An imbalance in gut bacteria, known as dysbiosis, may contribute to certain types of constipation, such as irritable bowel syndrome with constipation, or IBS-C. Probiotic supplements, particularly those containing specific strains like Bifidobacterium Lactobacillus, and Bifidobacterium species, have been shown to improve stool frequency, consistency, and transit time in adults with chronic constipation. A systematic review and meta-analysis by Ford and colleagues, published in 2014, found that probiotics, when compared to placebo, significantly improved overall symptom response and increased the frequency of bowel movements in patients with IBS-C. The study also noted that probiotics containing Bifidobacterium species were particularly effective in reducing constipation symptoms. Similarly, a clinical practice guideline by Meerin and colleagues in 2016 recommended the use of probiotics, specifically Bifidobacterium lactis DN 173010 and Lactobacillus casei shirota, for the management of constipation in adults. The guideline, published in the journal Revista Española de Enfermedades Digestivas, highlighted the potential of probiotics to improve stool consistency, frequency, and transit time. When selecting a probiotic supplement for constipation relief, it's essential to choose a product that contains well-researched strains and has been manufactured by a reputable company. Look for supplements that specifically list the probiotic strains and their respective colony-forming units, or CFUs, on the label. It's also crucial to store probiotic supplements according to the manufacturer's instructions, as some strains may require refrigeration to maintain their potency. Consulting with a healthcare professional can help guide the selection process and ensure that the chosen probiotic supplement is appropriate for your individual needs and health status. Fiber supplements are another popular option for managing constipation. These supplements work by increasing stool bulk, softening the stool, and promoting regular bowel movements. The most common types of fiber supplements include psyllium, inulin, and glucomannan. Psyllium, a soluble fiber derived from the husks of the Plantago ovata plant, has the strongest evidence for constipation relief and is recommended by the American College of Gastroenterology. Psyllium works by absorbing water in the intestines, forming a gel-like substance that softens the stool and promotes its passage through the digestive tract. A meta-analysis by McRory and Che, published in 2016, found that psyllium supplementation significantly increased stool frequency and improved stool consistency in patients with chronic constipation. The study also noted that psyllium was well tolerated and had a low risk of adverse effects compared to other laxatives. Inulin and glucomannan are other types of soluble fiber supplements that have shown promise in relieving constipation symptoms. Inulin, a prebiotic fiber derived from chicory root, has been shown to increase stool frequency and improve stool consistency in constipated adults, according to a study by Mika and colleagues in 2017. Glucomannan, a fiber derived from the konjac plant, has been found to improve bowel movement frequency and stool consistency in children with chronic constipation, as reported in a study by Loening-Bach and colleagues in 2004. The recommended dosage of fiber supplements varies depending on the specific product and individual needs. For psyllium, the American College of Gastroenterology suggests a daily dose of 3 to 6 grams, taken with adequate fluid intake. It's essential to gradually increase fiber intake to minimize potential side effects such as bloating and flatulence. When taking fiber supplements, it's crucial to consume sufficient water to prevent the fiber from causing an obstruction in the digestive tract. Fiber supplements should be taken separately from other medications, as they may interfere with the absorption of certain drugs. Individuals with a history of intestinal obstruction or those who have difficulty swallowing should exercise caution when using fiber supplements and consult with a healthcare professional before starting a regimen. Now, let's talk about Senna, an herbal laxative derived from the leaves and fruit of the Senna alexandrina plant. The active compounds in Senna, known as sennicides, promote the movement of matter through the digestive tract and stimulate intestinal fluid accumulation. A high-quality, 28-day randomized double-blind placebo-controlled study by Morris Sheeter and colleagues, published in 2021 in the American Journal of Gastroenterology, found that taking 1 gram of Senna daily significantly improved stool frequency and quality of life compared to a placebo in patients with chronic constipation. The study participants reported a higher frequency of spontaneous bowel movements and a reduction in the use of rescue medication. However, it's important to note that long-term use of Senna at high doses may cause adverse effects, such as abdominal cramps, diarrhea, and electrolyte imbalances. Prolonged use of Senna may also lead to a condition called melanosis coli, characterized by a dark pigmentation of the colon lining, although this condition is generally considered harmless. Senna should be used cautiously and under the guidance of a healthcare professional. It's not recommended for long-term use, as it may lead to dependence and decreased bowel function over time. Pregnant women and individuals with inflammatory bowel disease should avoid using Senna, as it may stimulate uterine contractions and exacerbate intestinal inflammation, respectively. When using Senna for constipation relief, it's essential to start with the lowest effective dose and gradually increase as needed. The recommended dose of Senna varies depending on the specific product and individual needs, but generally ranges from 15 to 30 milligrams of sennicides per day. It's crucial to read the product label carefully and follow the instructions provided. In addition to magnesium, probiotics, fiber, and Senna, several other supplements have shown potential in relieving constipation symptoms, although the evidence supporting their use is limited. These include aloe vera, carnitine, vitamin C, and vitamin D. Aloe vera, a succulent plant known for its gel-like substance, has been traditionally used as a natural laxative, Some studies suggest that aloe vera may increase colonic mucus excretion and promote intestinal motility, thus alleviating constipation. However, more research is needed to establish the safety and efficacy of aloe vera supplements for constipation relief. Carnitine is an amino acid derivative that plays a role in energy production and fatty acid metabolism. Low levels of carnitine have been linked to constipation in individuals with severe motor and intellectual disabilities. A study by Shiopu and colleagues, published in 2022, found that carnitine supplementation improved bowel movement frequency and stool consistency in this population. However, further research is required to determine the effectiveness of carnitine supplements in the general population with constipation. Vitamin C, also known as ascorbic acid, is an essential nutrient with antioxidant properties. Some studies have suggested a link between low vitamin C levels and constipation in children. A randomized, double-blind, placebo-controlled trial by Xiao and colleagues, published in 2008, found that vitamin C supplementation improved stool frequency and consistency in constipated children. However, more research is needed to confirm these findings and establish the optimal dosage and duration of use. Vitamin D is a fat-soluble vitamin that plays a crucial role in calcium absorption and bone health. Recent studies have suggested a potential association between vitamin D deficiency and chronic constipation. A systematic review and meta-analysis by Panaris and colleagues, published in 2019 in the World Journal of Gastroenterology, found that individuals with chronic constipation had significantly lower vitamin D levels compared to healthy controls. However, the authors noted that further research is needed to determine the causal relationship between vitamin D deficiency and constipation, and to establish the effectiveness of vitamin D supplementation in managing constipation symptoms. While supplements can be a useful tool in managing constipation, it's essential to recognize that they should not be relied upon as the sole treatment approach. Combining targeted supplement use with lifestyle modifications, such as increasing dietary fiber intake, staying hydrated, and engaging in regular physical activity, can provide a more comprehensive and effective approach to constipation relief. Dietary changes, such as incorporating more fruits, vegetables, whole grains, and legumes into the diet, can naturally increase fiber intake and promote regular bowel movements. Adequate hydration is also crucial for maintaining soft, easy-to-pass stools, as dehydration can contribute to constipation. Regular physical activity, such as walking, jogging, or swimming, can help stimulate intestinal motility and promote regular bowel movements. Engaging in at least 30 minutes of moderate-intensity exercise most days of the week can be beneficial for overall digestive health. In addition to lifestyle changes, it's essential to address any underlying medical conditions or medications that may be contributing to constipation. Certain medications, such as opioids, antidepressants, and calcium channel blockers, can slow down intestinal motility and cause constipation. Working with a healthcare professional to manage these conditions and adjust medications as needed can help alleviate constipation symptoms. While supplements can be purchased over the counter, it's crucial to consult with a healthcare professional before starting any supplement regimen for constipation relief. A healthcare provider can help determine the underlying cause of constipation, rule out any serious medical conditions, and recommend the most appropriate treatment approach based on individual needs and health status. Furthermore, some supplements may interact with certain medications or have contraindications for specific health conditions. For example, magnesium supplements should be used cautiously in individuals with kidney disease, as impaired kidney function can lead to a buildup of magnesium in the body. Senna should be avoided by pregnant women and individuals with inflammatory bowel disease, as it may stimulate uterine contractions and exacerbate intestinal inflammation, respectively. A healthcare professional can help navigate these potential interactions and contraindications, ensuring that the chosen supplement regimen is safe and appropriate for each individual. They can also provide guidance on the optimal dosage, duration of use, and any necessary precautions or monitoring. In addition to consulting with a healthcare provider, individuals may benefit from working with a registered dietitian or nutritionist who specializes in digestive health. These professionals can provide personalized dietary recommendations and help develop a comprehensive plan for managing constipation through a combination of dietary modifications, lifestyle changes, and targeted supplement use. To sum up the key takeaways from this video, magnesium supplements, particularly magnesium citrate, magnesium oxide, and magnesium sulfate, have been shown to improve constipation symptoms by drawing water into the intestines, softening the stool, and promoting muscle contractions in the digestive tract. Probiotic supplements, especially those containing Bifidobacterium Lactobacillus, and Bifidobacterium species, may improve stool frequency, consistency, and transit time in adults with chronic constipation. Fiber supplements, such as psyllium, inulin, and glucomannan, work by increasing stool bulk, softening the stool, and promoting regular bowel movements. Psyllium has the strongest evidence for constipation relief and is recommended by the American College of Gastroenterology. Senna, an herbal laxative, promotes the movement of matter through the digestive tract and stimulates intestinal fluid accumulation. However, long-term use of Senna at high doses may cause adverse effects and lead to dependence. Other supplements, such as aloe vera, carnitine, vitamin C, and vitamin D, have shown potential in relieving constipation symptoms, but more research is needed to establish their safety and efficacy. Combining targeted supplement use with lifestyle modifications, such as increasing dietary fiber intake, staying hydrated, and engaging in regular physical activity, can provide a more comprehensive and effective approach to constipation relief. Consulting with a healthcare professional before starting any supplement regimen is crucial to ensure safety, appropriateness, and optimal dosage based on individual needs and health status. By understanding the evidence behind various supplements for constipation relief and working closely with healthcare professionals, individuals struggling with constipation can take a proactive and informed approach to manage their symptoms effectively. Remember, while supplements can be a useful tool, they should be used in conjunction with lifestyle modifications and under the guidance of a qualified healthcare provider for the best possible outcomes. That's all for this video on supplements for constipation relief. We hope you found this information helpful and informative. If you're looking for high-quality supplements and expert guidance, be sure to visit nutritionmarket.com.au. At Nutrition Market, we offer a wide range of supplements and have a virtual clinic with clinical nutritionists and naturopaths serving clients in Australia and around the world. Book a consultation today to get personalized advice and support for your digestive health needs. Remember to hit the like button if you enjoyed this video and subscribe to our channel for more content on nutrition, health, and wellness. And keep in mind that while the information provided in this video is informed by research, it should not replace advice from your healthcare provider. Some scientific findings may still be under investigation, and it's always best to consult with a qualified professional for personalized guidance. Thanks for watching, and we'll see you in the next video.